and welcome to Island Assignment, WALK's award-winning weekly feature that looks at issues and challenges affecting listeners on Long Island.
It hasn't even been an entire week since summer ended officially. Why are some people already talking about the flu? More on that in a moment. But first, we're 1 week away from Mental Illness Awareness Week, an event designed to help end the stigma of mental illness and get help for those who need it. Here to tell us more about what's going on that week here on Long Island is Michael Stoltz. He's the CEO of the Association for Mental Health and Wellness based in Ronkonkoma. So glad you could make it here today.
Thanks for having me, Donna.
Now, your group is the Association for Mental Health and Wellness. You're based right here in Ronkonkoma. Your group is actually brand new, but is the result of a merger, you might say, of 3 established groups here on Long Island. Why don't you tell us about that?
The base of the organization is Clubhouse of Suffolk, was founded in 1990 by members of the Alliance for the Mentally Ill, who each of whom had adult children with serious mental illness. And that organization is Clubhouse of Suffolk. Has been around since almost 25 years. A few years ago, we got together with another organization serving veterans, Suffolk County United Veterans, which has a homeless shelter and 7 houses for homeless and at-risk and formerly homeless veterans. And just last year, finished a merger with the Mental Health Association in Suffolk, which has been in Suffolk for over 50 years.
So why the reason for this merger?
Well, 2 different reasons for 2 different mergers. So Suffolk County United Veterans, I think the media has been full with information about returning veterans, understanding the impact of post-traumatic stress disorder and other mental health issues that impact a portion of our veterans, and kind of more highlighted in our most recent conflicts. So many of the folks the men who were coming for services at Suffolk County United Veterans needed mental health care. So that was a kind of clear, good marriage. The Mental Health Association in Suffolk has mostly been on the information referral and professional and workforce training side of things. So with the way things are going in the mental health system and mental health care, the focus on helping people to access care is more important and more significant than ever, and I'm sure for some of the reasons that we'll talk about in just a moment. So for one agency that could handle this range of issues for people who are first time looking for care, for veterans who are first time looking for help with mental health care, up to an organization that's experienced in working with people who have serious psychiatric disabilities, we now have kind of the whole spectrum of being able to help people who have mental health challenges.
It's 1 week until National Mental Health Awareness Week, which is why, in fact, we asked you to join us here today. The timing was right. Tell me what this week means to your group and what you're going to be doing.
It's National Mental Illness Awareness Week, and because there's a lot of mystery and misunderstanding about mental illnesses, and there are a number of different mental illnesses. So Clubhouse of Suffolk has taken the lead in Suffolk County for over 20 years in bringing recognition by having an event. We used to have a one-day event where we brought in people who are in the public limelight to discuss their own personal experience with serious mental illnesses. So over the years, we had Patrick Kennedy, Patty Duke, Margot Kidder, Rod Steiger, Jim Jensen, a range of people who had been courageous enough to be open about their experience with mental illnesses and their recovery. So along the way, we decided that we would change our strategy after 20 years. Sometimes you have to do things a little bit differently. And we decided to make it a week worth of events and to engage partners of other organizations and agencies and health and behavioral health providers to do a range of events to bring recognition across Long Island. Most recently, in this effort, we partnered with the Mental Health Association of Nassau County, and they have helped to generate a number of activities in Nassau. So now we have about 35 to 40 activities just about mental health and mental illness all across the island.
The big event is the kickoff. It's on Monday, October 6th. It's a Long Island Town Forum on mental health. Tell us a little bit about the panelists this year, some of the issues you'll address.
Well, I think, mental illness has been in the news for all the wrong reasons for the past couple of years, from the tragedies at Sandy Hook and in Washington and in other places where people who have needed care and were not getting care, unfortunately progressed so far with their not getting care that they became violent, and it took the life tragically of other people. So those kinds of events miscast what happens for the 99% of people with mental health problems and mental illnesses, which is by and large almost never an issue of violence, but more an issue of people not having gotten the care they needed when they needed it. So that's what our kickoff is about. It's about kicking off this week of events and asking questions about what is the impact of stigma of mental illness. What are the myths and what are the realities? Then we're going to dig a little bit deeper and look into kind of questions of how can we do better? How can we avoid those awful tragedies like at Sandy Hook and other places in the country that have involved people with serious and untreated mental illnesses? How can we do things differently so that people aren't winding up in jails? And one of our panelists will be Sheriff DeMarco, who will talk about the preponderance of folks with mental illness in our jail who don't need to be there and shouldn't be there. Also on our panel is the Commissioner of the New York State Office of Mental Health, Dr. Sullivan, Harvey Rosenthal, the Executive Director of a large advocacy and trade association called NIAPRS, New York Association of Psych Rehab Services. The panel will be facilitated by Bob Detour of South Oaks Hospital in North Shore, LIJ, and it should be a stimulating discussion.
As you just said earlier, mental health has unfortunately been in the news quite a bit lately. I would say especially most recently after the death of Robin Williams. I think a lot of his fans were shocked that a man who seemed to love and embrace life as much as anyone, no one loved life more than Robin Williams, it seemed to his fans, that he could have committed suicide. So what are some of the lessons you would say that we can learn from that tragedy?
Well, first, let's understand what about depression. So when we talk about mental illnesses, the most common is depression. It is also as misunderstood as any other mental illness. In fact, we understand basically 1 in 4 adults in our lifetime, 1 in 4 adults in a given year will have a mental health disorder, and the largest percentage of that is depression. Depression can look differently to different people. For Robin Williams, some of the things that publicly we've understood is that he was dealing with a new diagnosis of Parkinson's. We also know that he had previously had heart issues. We also know he had a history of substance abuse issues. We know he had a history of depression, if not bipolar disorders. So for him, it's a very tragic scenario. We know he had been in care and such, and that's the one that really is perplexing and tragic. And is here's somebody who had used care. So I think that the message, the learning from that is depression is common. It has nothing to do with wealth, fame, or fortune. It has to do with this is an illness that is common and occurs and is treatable.
And perhaps one myth that too many people believe as well is that depression, mental illness, that these things are a choice, that we can just snap out of it. Doesn't work that way, does it?
No, it doesn't. Some depressions and mental illnesses and anxiety disorders and stuff are reactions to events and trauma and tragic events like we've seen with our veterans. Others have no real clear explanation. Sometimes it runs in families, sometimes it comes, more from the inside than external events. So do we know who's at risk? We don't really know. There's indicators, there's clues, but the reality is what we need to do as a culture is to just understand depression, anxiety disorders, other mental illnesses are common and treatable, and we need to do a better job of recognizing them and recognizing them early and helping people to get help.
I would think that some sufferers might be more willing to seek professional help if it wasn't for that stigma.
Absolutely correct. That's right, Donna. So people misunderstand mental illness as a series of bad judgments, as you said before, just, hey, snap out of it, just be more responsible, be more aggressive, do this, do that. And sometimes depression is anything but something that people have full control of. But I will say there's more understanding and more resources than ever before. So yes, there's treatment, there's psychotherapy, medications. There's also alternative approaches that people use quite successfully as a part of a regimen, and sometimes complementary to treatment. And even more so is a growth in peer support. Meaning, just like is well understood for people with alcohol addictions and substance abuse, the power of being with a group of other people who have gone through the same things, that movement is growing for people who have had mental illnesses, to be with other peers and other people who have gone the same road, to be able to get that kind of support and to make decisions to be able to help facilitate recovery. And there is recovery from all mental illnesses.
Whenever there is a tragedy, for instance, like the Sandy Hook school massacre, it's not unusual to find friends and relatives who will acknowledge that that person, that the gunman, had a problem, but it's also not unusual for them to insist that they never thought that person would turn violent. Are we missing warning signs?
Tragically, yes. We do. Unfortunately, we tend to learn about suicide and other kinds of dangerous things and events. We learn what's underneath it in kind of like almost these kind of post-mortem kind of evaluations. What happened? Who knew what? What was the conditions and such that were going on? And whenever we do these, and I've been a part of these, and they're tragic, you see there are times where we could have potentially said the right thing, asked the right question to be able to help people to consider maybe there's another route to go. So there's a movement on right now, and our organization, the Association for Mental Health and Wellness, will be doing more trainings on what's called mental health first aid. Just like physical first aid, there's now a growing curriculum out there to be able to help teachers, police officers, clergy, people who are on the front line, youth workers, people who are on the front lines, to be able to recognize when people are struggling and what to say and what to do to how to be able to help people, just as if they had gotten a wound. So we're learning more. We're putting it into teaching modules to be able to help people to ask the right question at the right time to help people to get the help they need.
Again, National Mental Illness Awareness Week is beginning a week from now, October 5th. We mentioned your big kickoff event, the Forum on Mental Health. It's taking place Monday, October 6th at the Hilton in Melville. Any other events you'd like to mention that are coming up that week? It's still a growing list of 30 to 35 events. We have a number of films that, and each of the films will be followed by a panel discussion to be able to engage people in the audience, and then the panel will be available for individual help to help people to make connections that they need. But for example, on Monday, October the 6th, will be a film screening at the Charles Wang Center at Stony Brook at 6:30 of a film called Memorial Day, which is a really touching film toward veterans and veteran families. It's a film about a second generation the son of a veteran finding the materials and memorabilia of his father who was a veteran, and that memorabilia helped to tell a story of helping him to understand his father and his father's struggles in a different way. On Tuesday, October the 7th, is another film at 4 o'clock at the Wang Center called Here One Day, and we'll actually have the filmmaker, Kathy Leichner, will be there to discuss the film afterward. There's South Bay Wellness in Sayville. We'll be doing a presentation on Saturday, October the 11th from 11:30 to 1 on nutrition for mental health. So as we talked about, there's a range of kind of resources, ideas, strategies that people use to help address their struggles with mood. Right. It's quite a list. It's definitely a growing list. If we'd like to find out more about the rest of the events that are coming up, or if we'd like to sign up for the forum that you're holding at the Hilton on October 6th, which I believe you do require people to sign up in advance, right? It is totally free, but yeah, we would like to know how many people are coming in advance. Okay, so how can we sign up or get more information? If you go on our website, go to www.miaweek.com.
townhallmeeting.org, and you can click on Calendar of Events, and under Calendar of Events you'll see information related to each event, and then a link that will get you to register for that particular one, the Town Hall meeting.
Very good. Michael Stoltz, the CEO of the Association for Mental Health and Wellness, based here in Ronkonkoma. Thanks so much for joining us this morning.
Thank you for having me, Donna.